Let's bring him in right now.
Absolutely. We've got Dr. James Armstrong and Dr. Turk Satterly hanging out with us on set. Good morning, gentlemen.
Good morning.
Good morning. Thanks for having me.
We'll throw you a little softball question first, just to get everything rolling. We're asking folks, like we said, we're asking folks online what our favorite Leonardo DiCaprio role is. But James, do you have one that jumps right out at you?
Yeah, The Wolf of Wall Street.
Mm-hmm.
It's a good one.
Yeah,
that is a good one. Is that one of your? Do you like the movie more or his performance in particular?
Really, I like Margot Robbie. I think.
Okay, that's really when she kind of
it was her breakout for sure.
It was definitely a breakout for her. And
yeah,
I think he just did a good job portraying the character.
Mm-hmm.
Yeah,
it's kind of obviously based on a true story.
Oh yeah, right. Yeah,
that might be my second favorite role of his. Like just the manic energy and plus him and Jonah Hill just bouncing off each other.
Yeah, I love Jonah Hill too. That's a movie I have a hard time revisiting because it's just not a fun hang. It's Martin Scorsese, but I just didn't. It's like 3 hours long, and I didn't love it. Yeah, and so I just don't want to. I don't know. It's like it's hard for me to go back to some of those movies where the guy in it is like such a tough hang, you know. But Turk, what about you?
So I love the movie The Departed.
Yes,
he's excellent in that. But then also, as you were talking more about the role, his role in Shutter Island, as you get the plot twist, and you know it's been over 10 years. So if you haven't seen it, I feel like spoiler alerts are okay. But yeah, as you figure out that. He is what he's been searching for. That's just a great role.
Oh, but you see him throughout the whole film kind of slowly go more manic, and what a great movie. I remember seeing that in theaters and just blown away. Okay, on to more important questions, right? We've got you guys in. You both are new physicians at Frankfort Regional Medical Center, but we'll kind of ask you guys both. James, we'll start with you. Just a little background info. Where did you guys grow up?
Sure. So I was born actually in Baltimore, Maryland, but moved to Eastern Kentucky when I was 10 years old. My mom's from Kentucky, so one whole side of our family is from Kentucky, and I've essentially lived in different parts of Kentucky ever since 1993. I went to medical school in Louisville after going to college in Moorhead, Kentucky, and did my surgical training in Louisville as well. I worked in Western Kentucky after that for about 7 years, and then moved to Southern Indiana for 3 years, and then moved back to Kentucky, now in Frankfort, and happy to be home, actually.
Nice. So what part of your upbringing did you kind of know that you wanted to become a physician?
My grandfather, my mother's father, was a general practitioner, which is actually something that doesn't really exist now. But he was a general practitioner in the hills of Eastern Kentucky, and so he did everything from setting broken bones to delivering babies to doing primary care type things. And so when we would go to visit him and kind of see the impact that he had on his community, that really made me decide that I should pursue medicine. And I always liked science and biology and anatomy.
Kind of gave you some extra motivation there with the backstory, And then Turk, what about you? Where did you kind of grow up, and then when did you kind of know you wanted to be a physician?
Sure. So, speaking of Veterans Day, I was born in San Francisco on the Presidio. My dad was a general medical officer in the Army, and then grew up in Missouri, Fort Leonard Wood, Kirksville, Missouri, Rolla, Missouri. Rolla is a little town, about 15,000 people. Kind of has a similar feel of Frankfort. It's in the Ozarks, but it's not mountains, but it's hills, bluffs, creeks, just a beautiful area. And, whenever I drove through here, it kind of reminded me of home. Met my wife in high school, met her at the long jump pit. People were like, what does that mean? It's like, it means we met at a track meet. That's how young we were. Yeah. I went to college in Kirksville and went to medical school there as well. Did my orthopedic residency at De Pere Hospital. Looks like Des Perez if you don't speak French. It's a suburb of St. Louis. Yeah. And then I did a fellowship or a year of additional training in total joint replacement in Phoenix.
What drew you to orthopedics?
Sure. So my dad he started off as a general medical officer. That was kind of probably the end of that era, and then did an orthopedic residency. And, I wanted to become a doctor when I realized I couldn't hit a curveball. and was going to have to find a new path. And my high school football coach, he had a herniated disc in his back. And we had this great football season going, so he wouldn't have surgery because he didn't want to miss out on this season. Mm-hmm. And so he went from a guy that could beat me in a foot race to a guy that was limping around on crutches. And then he had this back surgery that took the pressure off his nerves. And I saw him a couple of weeks later, and he said, I never took any medicine for pain because I felt so much better. Wow. And I just wanted to be able to do that for people, to give them, the quality of their life back.
And you hear folks that say that, I feel like all the time, or maybe they feel like they need to get a surgery for however long, and when they have it, and they've kind of recovered, it's like, oh, I kind of wish I had done that however long ago.
For sure.
So I'm sure it's really nice to be able to see folks kind of make that,
Absolutely.
Yeah. So James, let's talk about advances in sort of technology and in the field. What kind of advances have been made kind of since in your time as a physician?
Yeah, I think for me, I finished my surgical training in 2014, which is not terribly long ago. But if you look at how surgeries are performed from then until now, certainly robotics, I think, has had a really game-changing role in surgery for orthopedic surgeons, but really for general surgeons and pretty much anybody that operates in the abdomen now. Using the robot, I think that the patients do better. They can recover much more quickly and kind of get back to the activities that they're used to doing without having to restrict themselves.
Yeah. Go ahead, Scott.
For a general surgeon, is the majority of surgery in the abdomen then?
Yeah, so general surgeons operate, we used to do actually the same things that orthopedic surgeons now do, but general surgeons primarily are operating within the abdominal cavity, but we also do breast cancers, skin cancers, skin lesions, little lumps and bumps. But we do a lot of gallbladders, a lot of hernias, a lot of people with appendicitis and things of that nature.
Yeah.
You mentioned robotics. What kind of benefits are there from robot assisted surgery?
Yeah, I think that the biggest benefit is a lot of surgeries that used to require big incisions on the abdomen, with obviously the concomitant recovery and soreness that is associated with that, now can be done with just small incisions. The visualization from the surgical end, we can see a lot better with the robot. We can actually see in 3 dimensions when we're doing robotic surgery. And for me, the nice thing is, instead of standing up and operating, I can sit down like this while I'm operating. So really, ergonomically for the surgeon, it's easier on us. And if you talk about the longevity of a surgeon, people don't really think a lot about that, but surgeons can actually extend their careers because robotic surgery is easier on us. It's easier on our hands and wrists. And we can sit down instead of having to stand for hours and hours at a time.
So you're using
surgeries.
Basically our joysticks. It's still your hands and operating the robot.
Yeah. So that's a common question. Patients come in and
right.
Obviously robots do a lot of things, right? They build cars, they do lots of things in factories. When we say robotic surgery, the robot is not physically doing anything other than translating my hand motions to the instruments that are in the patient. So the robot is not doing the patient's surgery. It's just essentially assisting me in doing the patient's surgery.
And Turk, what about you as far as advancements go with orthopedics and in your field?
Sure. So orthopedics is fractures, arthritis, tendon tears. I'm going to kind of limit this just for brevity to joint replacement. Yeah. So the biggest advancement kind of comes in 2 areas. One is in pain control, because the implants that we're putting in haven't really changed dramatically over the last 10 to 15 years. Everybody's kind of figured out the best plan for that. Now the advances are in pain control. When I first started, people with total joint replacements would stay in the hospital for like 3 nights. And now it's routine. If you're relatively young and healthy, you'll go home the same day or at most the next day. And that's not, again, because the surgery has changed dramatically. It's because of the pain control techniques. And then the thing that has changed dramatically, so I'm kind of saying both things, is the robot. Yeah. Now the robot for general surgery is drastically different than the robot for orthopedic surgery. If you walked into an OR without a surgeon and we're just looking at the setup, the robot, I almost say it looks like a spider, right? Like it's got these arms that come in and operates in the belly, and then the surgeon is sitting down over in the corner. With total joint replacement, you're still standing up doing the surgery, and it's a robotic arm that comes in. And so there's sensors that you put on the legs that point to a camera, and then you move the knee and then stress the knee. And this is where the true brilliance of robotics comes in. In the past, when we've done total knee replacements, it's a one size fits everybody plan that you then try to modify. Whereas with total joint replacement, you get a three-dimensional image and you're able to rotate the components with 6 degrees of freedom, meaning up, down, left, right, turning, and that balances the knee, kind of like balancing tires, right? So in total joint replacement, we talk about survivorship versus satisfaction. Survivor, I'm talking about the patient surviving. I'm talking about how long the implant lasts. So the implant survivorship is very good, but in total knee replacement, the satisfaction rate is in that 80 to 83%, even though everything looks good. Well, that sounds pretty good, except that means that 1 in 5 people are unhappy. Well, with the robot, with this dynamic balancing and a more patient-specific program, that gets the satisfaction rate to about 95%, which is now 1 in 5 people are unhappy. And if anybody tells you that it's 100%, then they're trying to sell you something, right? Because there's no guarantees in medicine. But the robot is the future of total joint replacement.
Well, if you put those new tires on, but you don't do the alignment, then they're going to wear out a lot sooner, right?
And it just doesn't feel the same.
Yeah, and I feel like there's been just major advancements as far as robotics. I mean, it feels like every year probably you guys are like constantly kind of staying on top of that.
Yeah, absolutely.
Yeah.
Yeah, I watched Prometheus last night, and it was unbelievable what that thing did. Yeah.
Well, before we let you guys go, tell us a little bit about personal life and family and hobbies. I know we've kind of gotten to that a little bit, but what do you guys kind of do? James, we'll start with you. What do you sort of do when you aren't there performing surgeries?
Sure. So I am married to my wife Elizabeth, and we have 2 daughters, Ansley and Caroline. They are 6 and 2.5, and so that takes up a large proportion of the time that I'm not spending at work, playing and enjoying their company. And then I guess the biggest thing that I do is ride bikes. So
cool.
I like to ride bikes on the road. So if you see me, please don't hit me. I don't want to visit him or learn any more about orthopedic surgery.
Share the road,
than I already know. And so I ride bikes on the road. I also mountain bike. Frankfort actually has a really nice mountain bike park at Capitol View
I've heard that.
So they've got like 13 miles of trails there that are accessible to multiple skill levels. I'm at the lower end of that, but hoping to work on that a bit, and also, again, not meet any orthopedic surgeons along the way.
That's right.
So that's pretty much what I do.
Nice.
Play with kids or ride bikes.
Turk, what about you?
Yeah, so like I said, I married my high school sweetheart. Been married for 22 years. I have 4 kids. Oh, thank you. I've been married for 22 years, have 4 kids. I have a sophomore at State Tech University in Lynn, Missouri. He's going to become an electrician. I've got a daughter who's a senior who wants to become a physician assistant, and then I've got a boy who's a sophomore and a boy who's a 4th grader. And in our free time, we like to get outdoors. We like to hike. This weekend is the opening weekend of deer season back in Missouri, where my family has a bunch of land. So we're going to go back and save Northeast Missouri from the dreaded buck population. Hunting, fishing, hiking. We like basketball. Sure. I like coaching youth basketball. And that's kind of what the Satterleys do.
Do you have a basketball team? Is there a college or even NBA team that you guys support?
Right. So I've always liked the Warriors since Steph Curry came around.
Sure.
Just the way they share the ball and move without the ball, as opposed to I love watching Luka, but he's ball dominant, and it's not the same style of play. So I like watching the Warriors. Growing up in Missouri, it was tough. being a college sports fan. So I think we're ready to adapt UK as our college team.
Let's go.
But from a professional standpoint, I'm a Missouri team, so that'd be the Cardinals, the Blues, the Chiefs.
Oh yeah, and the Chiefs they survived I think a real close one yesterday against the Broncos.
Winning on a blocked kick.
Mm-hmm. Yeah, right.
With a drawn up play, like not luck.
Yeah, crazy.
All the luck seems to follow Mahomes and Kelsey.
It does.
So there's a great quote about that. It's called "Chance Follows the Prepared Mind" by Louis Pasteur.
I like that, actually.
So it's like luck follows people that are prepared.
Okay. Maybe that says a lot about why I'm maybe one of the most unlucky people on the planet. So I'll keep that in mind.
There's a lot of NFL conspiracy theorists out there that like to complain about the Chiefs. But if you like ball movement, Kentucky's the place to be right now. It's a whole different world.
There you go.
Yeah, you should enjoy watching those games this year.
Thank you guys for being here.
Yeah, absolutely.
Thanks for having us.
Again, Dr. James Armstrong and Dr. Turk Satterly at the Frankfort Regional Medical Center. They'll take care of you if you need any.